Here we are in supine. The most important initial thing I really want to stress for all therapists, but as we're making sure we focus a little bit on making sure that males in particular feel secure, but I just also want to say this, right, is applicable to us all, regardless of gender, anything. Having a client being supine and having draping materials taut against the body is revealing. So if we can avoid that, and one of the more other difficult aspects of this can be if we're using white linens, that they can be a little bit transparent. So in those circumstances, and especially for female clients, if those linens are transparent, then you gotta have some additional coverage or get different sheets. What an idea, right? But for all clients, not having it be taut. So when we get them set in supine, not this, okay? Make sure everything has, around the pelvis, around the chest, everything should just be a little bit looser. As I turn them, it's a little bit easier. Right now, for me to be doing this and adjusting it isn't quite as proper. But get it not, like a tarp tight against their body. And then the regions here in supine that we need to consider, other stuff isn't too complicated, frankly. It's just going to be the nature of how can we work on the hip flexor region, the abdominal area, and the chest. Now, in my routine, I tend to start here in the interior upper leg, and this extra piece of draping material, blanket. A lot of times therapists already have the blanket on top anyway, so this can be the element that is just utilized more. Here, remembering getting that sheet between the legs, and then I'll have you scoot your leg a little bit towards me. Thank you. And we're good to go. And if I had to, I could bring the sheet over, all that. Now here's the tough part for people. What do we do here when we know, I'd like to think that we know, how important it is to work here? Sartorius, rectus femoris, tensor fasciae lata. As they come up and unify in the anterior superior iliac spine, I know TFL doesn't necessarily, but they're right there. And then going a little bit lateral, this doesn't show it too well, but gluteus medius and minimus as well. How do we work here without it being misinterpreted? And being also as efficient and productive as possible. The honest truth for me is that region, you work over the sheet. If we had to drape for it, we can. There's contour options where I find the edge of the sheet, I bring it up underneath the leg, and I create that lasso, scoot that up, all of this, and I can work my way while also using this sheet to hold it down more effectively to get direct skin contact in this region. Totally an option, right? But with first-time clients, and with our focus being on how to make a person not be in a position where they misinterpret, that area, I feel like it's pretty isolated. You might as well do a static compression plus movement. It ends up being very similar to what I was talking about with the glutes and deep lateral hip rotators in prone, that by incorporating some joint movement, we are then able to make it clear that our intention in this region is about the hip, okay? So what I do is also, rather than letting, clients tend to be dominant in this externally rotated pattern anyway. And that also makes where contact in the medial region of the thigh and pelvis is a little bit easier to accidentally do. Thus, when I'm going to work here, if I just internally rotate that leg preemptively, it makes it to where my contact point isn't going to fall closer to the pubis. I want to be over here on the anterior superior iliac spine and then tracking lateral, maybe just superior and anterior to the greater trochanter. So if I just internally rotate that leg, which from a joint movement perspective is something that I would prefer to reinforce for clients anyway, it also kind of creates a buffer, male and female, all genders, where I can then apply contact here with a clear sense that we're not going to make an inadvertent contact in that pubic region. So here, and then all I have to do with this hand is little, I'm keeping this passive, thinking about more of a relaxation, stress management outcome. Then I can just real rhythmically, slow or fast, include that joint movement, and then it's going to cause some friction, get those tissues to mobilize a bit more efficiently, but also create that interpretation that we're doing this related to hip benefits and outcomes. So preemptively turning the leg in, then applying our compression on the area, and then rhythmically moving the joint and standing in such a way so my hand and arm is all oriented distal, away from the pelvis, right? I don't do it like this. That's silly. Stand on an angle, or teach to stand at an angle, and here. So we can see that on the other side. And I can track, I just increase my elbow flexion, and I can work on everything from the immediate hip flexors, rectus femoris, sartorius, tensor fasciae lata, and I can track laterally in the gluteus medius and minimus. Over on the other side, so you can see that. Same thing. Drape. My protocol tends to initially warm up this lower aspect and lateral aspect of the upper leg. But if I'm going to try to work, if I were limited or choosing to work predominantly in prone and supine, which as you've heard, I don't suggest, but if people are going to do that, then we can work on the adductors in this orientation. But then what we really need to make sure we're doing is, again, using a forearm, orienting our hands away from the area, and then going across like this. Do not need to track too high. We can get most of the adductors. Thinking just like maybe just above the middle aspect of the femur, and then work our way down towards the knee. And I can turn the leg over, internally rotate, work my way up, vastus lateralis and IT band. Once I hit that bulk of the sheet that's in my way, I pin the leg in this position, bring the sheet down, then use that forearm, static compression. I'm going to be more anterior to start, just below the anterior superior iliac spine, right there. And then I'll increase my elbow angle, and that'll take me more lateral. So here, little rotations. If I needed to make this more about more of a therapeutic change kind of outcome, more mobility centered, then I could always ask the client to actively move their leg back and forth. All right, that's how I can just keep working my way laterally. Now I'm thinking gluteus, medius, and minimus. And we're done. So, reinforces what I was saying earlier in sideline. Even this stuff, we have to accept that occasionally it may be a beneficial option to show our students that over the sheet is an option. All right, now for the chest. One thing here, how do we find their arms, right? If client is tucked like this, rather than me coming up under and grabbing, then I need to just ask, right? So, client, can I have you bring your arm out for me? Thank you. And that is a perfectly acceptable thing to do. Just ask the client to do it, okay? And stand in such a way where as they do that, you're not gonna see anything. Don't stand at the head of the table, or don't teach to stand at the head of the table and ask them to do that. If they're under the sheet like this, then what I can do is at least have my hand come across, find their wrist and hand, just undrape wrist and hand, come out. And that's how I show to undrape the arm to eventually work in the anterior chest. Now, here is another place where open palm, I really try to avoid showing that as an option. I mean, I show it as an option, but I try to reinforce that we can be just as beneficial with a fist and a forearm. So here, over the sheet, totally an option. Can position, hold in a whole variety of ways, and come in and work on pectoralis major and minor in this way. A soft fist works better in this orientation. It'll be a little bit more aggressive, more myofascial. The way to use a forearm for the pecs in this position is right like this. I show contact the table. This is to avoid inadvertent pressure on the clavicle. So if they contact their hand against the table as they bring their forearm down, it's almost impossible to miss. The only thing they could do is be too much over on the joint line of the glenohumeral joint, but if they just bring themselves down to just be on the upper ribs, can't really miss. And then just like what I've been saying about how can we create the impression that what our application is about is the joints and soft tissue, if we incorporate this joint movement element, it has a much clearer sense of purpose and thus limits misinterpretation, right? So right there, that's all over sheet. To drape, this is the benefit of these, the blanket or whatever, to act as a buffer, because I can position that to create a line where I want the sheet to stop and then drape there. But we do not need a lot of space here for draping. And then if I create that bunch here, then I can use my forearm and just push the sheet a little bit, and that's as much contact on the skin I usually need here. It works for the forearm in this position, and works great for soft fist in this position. So not difficult, both options work wonderfully. Okay. Now, working on the abdomen. This is just a general tip and trick, but I suggest always having their knees bent, feet flat on the table while working in the abdomen. Okay. To start, this is also a perfectly acceptable place to just go over the sheet. But let's verbally explain our way through our process. And there's certain things here where it's just like we don't need to be lower than the belly button unless we're doing some kind of deeper release work like psoas. But that's not the purpose of this series. There's other videos out there for you for that. But if we're going to start with what would feel like a safe way to introduce a client to abdominal work, I tend to suggest following the rib line and freeing up where the abdominal muscles, especially rectus femoris, comes up and attaches, and that line where it's sitting over the external oblique. These are safe contact points that aren't in a more sensitive region, okay? And by helping create some release here, that certainly will free up the abdominal wall and allow the diaphragm to function a bit more efficiently. So maybe we need to start showing our students just a very non-invasive, simple version of how to introduce these principles. And then once they have been able to confirm with the client that the client's comfortable and aware of the benefit of said application, then we can start getting a little bit braver with our draping and be a little bit more focused in each region. But then same thing, it's just rhythmic compression or long holds of compression where I find something along that rib line. Then what works really good here is creating a torsion force on the whole abdominal cavity, and we can frame this related to the low back. In order to work here, we just have a person turn their knees towards the therapist. Therapist then is going to make contact as far as they really comfortably can here, and then lean back, can be 2 hands or 1, and then ask the client to turn their legs the opposite way and to create a nice torsion, twist, stress into the abdominal cavity and wall. And this is a nice pull on the everything from the lumbar spine and lumbar dorsal fascia all the way over and across. Okay, and relax. Now, to be more specific, and showing some draping measures here. If I needed to be more specific, it doesn't have to be particularly complicated. I have this already. I have the client just hold here. I always suggest with students that when they're introducing this, they work over the sheet first, confirm that that's beneficial, it seemed like it was helpful, get the client's input and interpretation of it, and then say that in the following session, it may be a good idea to be a bit more thorough and do a little bit more here because it seemed to obviously help. But we got to kind of prove that and make sure we're coaching our students to have that that conversation and explanation for our clients. But here, client just holds the towel or blanket, and we don't have to be delicate about it. I just pull that sheet down, and we do not need to be draping big, right? This is very small. And then what it allows me to do is then I could work more specifically. Let's say we have some scar tissue, anything like that. For this whole lumbar thing, I'll create a little space here so you can see, and that allows me to do that whole thing where I can grab all the way around to the lumbar area and just create a nice big pull, and then client's in control. And from a myofascial perspective, this is certainly the more effective option, but I want to show and prove that the draping here is very modest. Now, when and where you choose to do this is part of the question. When we show where in the protocol it fits, it could be at the beginning of supine and at the end. For me personally, it tends to be at the end. For others, it can be at the beginning. I like to close sessions with a little bit of something more active to kind of help wake the person up. But if you did choose to do it at the beginning, and we can easily just take this sheet, bring it right over top, and now that blanket is sitting there. But I tend to like to have the coverage on the torso through as much of the session as possible and do this whole thing to close sessions. I'll do everything from, in the pattern I show, like anything, I'm always showing preferences, but also being clear about giving the students options of what seems to flow and fit best for them. I tend to work on the legs, hip flexors, come up, chest, arms, close with the head, neck, head, scalp, and then as a way to kind of do one last thing, whether it be for breathing, whether it be for digestion, and more commonly for low back dysfunction, to end with saying, okay, I have one last thing we'll do for your low back. So we're going to get the bolster out, bring your knees up, feet flat, and then we could do that whole process of doing this. It's a little bit of an active movement element, and from a customer service standpoint, it's also a way to do one more thing for the low back. But ideally, all of this shows that there can be pretty simple, no-nonsense measures to just make our clients feel safe and comfortable with any therapist. The key takeaways I would like to highlight are the principles of 1, using this additional, whether it be a blanket or towel draping material, all this has to be is rolled up into a tube and then put in kind of a U shape, upside down U shape, just below the face cradle in prone. And we saw how we can use it across the torso in side lying, and then here in supine. Next is that idea of, if we're navigating the table, being aware of where we are, and as we walk around, not walking without making contact with their body and our legs and torso touching the table and walking by, and then inadvertently hitting them. We need to much better to stay in contact with them, and as much as possible with both hands. That in itself is going to make it to where it's less likely for you to walk by and just hit them with your body, okay? So like when I'm walking around the table, 2 hands, right? Then they know where I am the whole time, even while I'm working. 2 hands. If their body is somewhere, repositioning them in such a way where then I'm able to access the area. So if the arms were down and I wanted to work here and I don't want to inadvertently touch there, moving the arms out of the way. It tends to be the most important part of their body you need to move out of the way, because we just don't want their hands basically accidentally touching our bodies. And then while working in regions that we have to be a little bit more cautious, I strongly suggest incorporating some element of joint movement to create a more clear sense of the purpose of working in each of those regions. And further, just being sure that we reinforce for our students to talk and clarify more with first-time clients. And there's a lot to be said for just the verbal attempt of clarifying with the client that I want to make sure that you feel as safe and comfortable as possible. And anytime, you just let me know, and I'm going to check in with you a lot more in these first few sessions to confirm that you're feeling comfortable. And then in the future, you know, I won't have to bug you and chat at you quite as much, kind of a thing. So I hope that that highlights the key principles that I really think that if we could include these elements more, it'll make all therapists, male, female, anywhere in between, more comfortable with being able to get through this landscape and work in all areas of the body without a concern of misinterpretation, and, well, not sacrificing our ability to be efficient and provide the care that we want to. So thank you so much.